ready, we shall move straight to the issue. The Ministry of Health would like to update the public on the current status of the COVID-19 pandemic, vaccination against COVID-19, and measures to curb the importation of the new COVID-19 variant, also known as Omicron. I'll start by giving you an overview of COVID-19 in the country. To date, the country has registered 127,485 confirmed cases of COVID-19 and 3,252 deaths. Furthermore, the current admissions stand at 115 in both public and private facilities. The country has sustained low transmission of COVID-19 with a positivity rate of less than 5% since September 2021. I'll now move to the Omicron variant. The B.1.1529 variant of SARS-CoV-2, also known as Omicron, was first identified by scientists in South Africa in a specimen that was collected on the 9th November 2021, and later from specimens collected between the 12th to the 20th of November 2021 from Gauteng, South Africa, Botswana, and Hong Kong, and subsequently reported to the World Health Organization on the 24th of November 2021. A meeting of the World Health Organization Technical Advisory Group on Variant Evolution held on 26 November named it the Omicron variant and designated it a variant of concern. Since its initial identification, the variant has spread significantly to reach all provinces of South Africa. It has also been identified in countries neighboring South Africa, namely Lesotho, Malawi, Mozambique, Namibia, Zimbabwe, Angola, and Zambia, as well as among travelers to distant countries including Netherlands, Thailand, Israel, United Kingdom, the Czech Republic, Italy, Belgium, and Germany, with the list of countries continuing to grow, and I am very sure that more countries have been added onto the list as of today. Not much is known about the variant since it is new, but this variant is reported to have 32 mutations. Those are what we call genetic changes in the spike protein gene, that is the coat of the virus. And there are more than those that have been identified in several other variants of concern, including the Delta and the Alpha variants. These changes, it's feared, could potentially render the virus more infectious, more transmissible, and harder to detect using available laboratory tests, and may cause more severe disease. However, these are still under research and yet to be well documented. While the Omicron variant has been reported in several countries across the world, it is important to note that this variant has not been detected in Uganda. The World Health Organization is coordinating a large number of researchers across the world to better understand the Omicron. Studies currently underway include assessment of transmissibility, severity of infection, performance of current available vaccines, performance of available COVID-19 diagnostic tests, and effectiveness of treatments. More information will be available in the coming weeks, which will be shared with the general public. In the meantime, The Ministry of Health continues to closely monitor the evolution of the spread of the Omicron variant globally, and in this respect, a number of measures have been instituted to prevent the importation of the variant into the country. So I'll now go to government interventions to curb the importation of the Omicron variant. Management of travelers in and out of the country. We have intensified surveillance at points of entry, with particular emphasis at the high volume entry points, notably Entebbe International Airport, and high volume land border points like Malaba, Busia, Mutukula, Elegu, Mpondwe, and Katuna, where people cross on land and they come from several of the South African countries. The following is being done based on a scientific approach and after careful analysis of the risks. 1. The government of Uganda instituted mandatory testing of all incoming travelers upon arrival at Entebbe International Airport on the 28th of October 2021. To date, 48,259 samples have been tested, with 228 positive cases recorded. On average, 6 positive cases are recorded daily. Testing of all incoming passengers at Entebbe International Airport will continue. However, passengers will be allowed to proceed to their destination once their sample has been removed. We believe that the daily average of 6 cases is still a manageable number that our surveillance teams can easily track and follow up. 2. Testing of incoming travelers at other land points of entry will be conducted by the private laboratories at government set rates, as Ministry of Health continues to build capacity for testing as directed by Cabinet. 3. Persons who test positive shall be tracked and put under home-based care or health facility-based isolation, depending on the severity of disease. Asymptomatic cases or people who don't have symptoms will be placed under home-based care and followed up by the Ministry of Health using our toll-free line, which is 0800 100 066 on a daily basis. The positive cases will be subjected to a repeat PCR test on the 7th day. 4. Symptomatic cases or patients or people with symptoms requiring admission shall be managed at designated COVID-19 treatment units. 5. All positive samples from travelers shall undergo genomic sequencing to enable detection of the Omicron and other variants. 6. All travelers are requested to be honest and sincere when sharing details of their addresses and contacts. This is to enable prompt follow-up to prevent the spread of the virus. This is to enable prompt follow-up and prevent spread of the virus. Giving false addresses puts the entire country at danger. The Ministry of Health is relying on you to help us in this exercise so that we avoid holding travelers at the airport, but at the same time, take precautions to avoid spread of infection. Additional measures. 1. Samples taken from alerts or people who develop COVID-like symptoms from communities within the country. Samples from such individuals that test positive will also be subjected to genomic sequencing. This will enable us to search for presence of the Omicron variant in the country or any other new variant that may develop in the country. 2. increase the uptake of COVID-19 vaccination. The vaccination campaign is being accelerated to increase coverage, and we are calling upon all eligible people 18 years and above. Please turn up for vaccination in large numbers. We have adequate vaccines, and we have opened up vaccination at various sites. 3, adherence to COVID-19 standard operating procedures. This is a must, including mandatory use of face masks when in public, maintaining good hand hygiene at all times, avoiding crowds, and keeping a distance of at least 2 meters. These cheap preventive measures help us to stop the spread of the virus. The more COVID-19 circulates among the communities, the more opportunities the virus has to change or mutate. It is therefore extremely important that we all work to reduce the circulation of COVID-19 virus to interrupt mutations. I'll now talk about vaccination. The government of Uganda prioritized COVID-19 vaccination as a strategic intervention to control the pandemic, including the effects posed by the new variants. So far, 6,973,161 doses of the COVID-19 vaccine has been administered to the population. Of these, 5,767,857, which is 25% of the 22 million eligible persons, have received the first dose of the COVID-19 vaccines, while 1,205,161,000, which is 5%, have received the second dose. To date, government has received a total of 17,131,090 doses through donations and direct procurement by the government of Uganda, of which 10,523,853,000 doses have been distributed countrywide. Distribution of the remaining 6,607,237 doses is ongoing. We expect additional 15,563,650 doses of various vaccines by the end of December 2021, giving us a total of over 32 million doses by the end of December. In order to increase uptake, the ministry has expanded the vaccination activity from only static sites in the health facilities to include outreaches in the communities like villages, places of worship, taxi parks, markets, etc. This is intended to bring the vaccines closer to the communities. Therefore, against this background, the Ministry of Health commenced an accelerated mass COVID-19 vaccination campaign, starting with the regions with high COVID-19 infection rates. The campaign so far has covered the regions of Teso, Lango, Kigezi, and Acholi sub-regions. Lastly is opening up of weekly markets. During his address to the nation on the 22nd September 2021, His Excellency the President directed that weekly markets in hotspot districts of Soroti, Kampala, Kalungu, Kabale, Kumi, Tororo, Gulu, Nwoya, and Yumbe remain closed. He directed the Minister for Health to review their situation for safe reopening. Since that time, intense surveillance, management of cases, and vaccination against COVID-19 has taken place in these areas. They are no longer hotspot areas, and therefore I would like to inform the district task forces and the public that the weekly markets can now be opened, but with strict adherence to standard operating procedures and the curfew hours. In conclusion, I would like to appeal to the population to remain calm, embrace and take seriously the COVID-19 vaccination exercise. Getting vaccinated and adhering to the standard operating procedures will protect you and your loved ones from getting infected with COVID-19. The COVID-19 vaccine is safe, it is effective and free. It will protect our country from the devastating effects of COVID-19. I thank you for listening to me, for God and my country. I'm not going to take your questions.
I will take some of the questions and I will share this. My colleagues will also come in. My name is Misaki Wayengera. I chair the Scientific Advisory Committee on COVID-19. I think the issue around the public health implications of people not telling the truth about their address is something that the minister will talk about, but we've discussed several amendments in the Public Health Act, and the Attorney General often comes up with the legal implications for going against some of those. Yes, countries elsewhere are issuing boosters. We've been looking at the data coming out of different countries. The US, the UK, Israel, with an indication that vaccine immunity potentially wanes over time. This is not surprising, partly because when it comes to immunizing against influenza-like illnesses, vaccines have been historically given on an annual basis, largely because you have new variants emerging, but also because the immunity tends to wane. So our groups are doing a lot of work in this direction, really trying to understand how long the vaccines last. That in addition, of course, with the understanding of equity, that we have so many people who have not yet been vaccinated. It becomes a difficult thing in terms of public health to encourage people who have gotten a second dose to go for a third dose when there are people who have not gotten a first dose. So the policy direction will come as the number of people who have received the second dose increase. And as I think Cecilia has noted, the number of people who have received the second dose of the vaccine is still smaller than the people who have received the single dose. So previously, statistics, the modeling that we had shown that we could potentially have a third surge by November 2021. What could have happened? I'll tell you that we premise so much on models, but models literally just help us understand. They are not perfect. The computer scientists say if you put in garbage in a computer, it will also put out garbage. The time we opened up when there was substantial residual transmission taking place. We took decision to open up this country largely because we have to balance between the, controlling the pandemic as well as the impact of, the measures on the socio-economic and other factors around COVID-19. So the numbers that were being fed in, there was some high level of cases, and people didn't know that this would fall. The other thing, of course, we didn't understand is the amount of penetration. Remember, we've been vaccinating. Yes, we've not vaccinated so many people, but we don't know how deeply the virus penetrated our communities during the second surge. It's possible. If you look at COVID-19, 80% of the people have no symptoms. And then the other small 20-15% have symptoms. So it's possible that a lot of people got exposed and some people are immune. Remember, we've had a mixture of rain, but we were also coming out of a dry season. So there is a mixture of many things. The environment, the changes in the bag. We've just seen a study come from Japan suggesting that the Delta variant can mutate into a less virulent version of itself, which literally spreads around but doesn't cause a lot of disease. So many things are at play, really, and it's impossible to point out at one thing. So don't be surprised that our models were wrong. It does happen. There's a difference between what we model and what is real. The technology, the Thermo Fisher technology, this is a PCR kit which literally detects both the S as well as other genes. The most important reason we are interested in the S gene is because the overmutation, so many mutations in the S gene in the Omicron render all the S gene kits not sensitive to that section. So if you are detecting a mutant, the Omicron mutant, ideally the kit will not show a positive signal on the S gene. So that's how you will differentiate between the Omicron and potentially other variants. I need to tell you that there are other kits as well that detect the S gene. It's not only the Thermo Fisher. And we are looking around which is potentially the most cost-effective kit for us to deploy. And the ministry working with CPHL and Uganda Virus, we are addressing that. $200 for sequencing, what's the plan? The government has been sequencing, although you never get to see this, we don't report this in our press report, but almost every 2 to 3 weeks, we have sequencing information that we are looking at. And I want to assure you that from the sequences that came out early this week, we are sure all the positives that we are picking from Entebbe are on the Delta. And so we don't yet have Omicron. So we have this running, and government and working with our donor, our partners, including CDC, are supporting this. South Africa, the South Africans coming for Christmas. I want Dr. Henry to come and talk about the challenges in terms of, we've taken a very strategic and informed decision. You realize very early some countries woke up and decided to close off the South African countries. But there is no science to support that. First of all, the Omicron variant is perhaps one of the easiest to detect because you can easily screen for it. And Uganda is already carrying out enough measures, literally, to control against the importation of variants. Secondly, we don't have enough data about the severity of disease that emerges from Omicron. So a lot of things really have to be understood without necessarily jumping to, take measures which potentially could affect not only our relationship, but also, of course, looking at if we have a measure that the ability to detect the Omicron, then why stop the people from traveling? So I think Maybe Dr. Henry, you need to talk about some of these challenges in terms of why some of these decisions were taken. But I have spoken to some of the questions. The Honorable Minister will clarify on the policy issue regarding the public health implications. Lisa, you want to say something? Because of the sequencing, the supporting of UVRI.
Sure. Good afternoon, colleagues and things. The first is the genomic sequencing, and yes, you know, that is really important. Many countries, I think as of this morning, at least 23 countries in 5 of 6 WHO regions have reported this. And it's important here that we continue to do the sequencing. So far, we've only seen the Delta variant recently, but that could change. And I think that having good strategies that you've heard from one of the journalists, the test is expensive, it's difficult to perform. So making sure that we're testing travelers and we're testing other people at high risk is important. I think we're fortunate that Uganda has many strong laboratories, Uganda Virus Research Institute, the National Lab Department, and others. So we have the ability to do that testing. One of you asked about the risk for people who are fully vaccinated, and I think as you heard from the Honorable Minister and from Dr. Misachi, there's a lot we don't yet know. Is this new variant more transmissible, more virulent? What effect will it have on treatments and vaccines? But I think we can say that, as the Honorable Minister has said, getting vaccinated, getting that second dose to be fully vaccinated is probably one of the best strategies that we have right now. And we all learned of this information late last week. So we're certainly still learning many things about this particular variant. I'm happy to answer other questions, but I think those were the two that I wanted to chime in on. Maybe just to say one more thing that the Honorable Minister talked about is just the importance of having good information. That includes people who are contacts providing that information. That includes you as journalists providing accurate information. You know, that's our best hope of understanding what this variant is doing and when it arrives in Uganda and how to control it. Thank you.
Do we take another round of questions?
Your hands.
Okay, but they don't just spray, they wipe. Eh?
Okay.
Spraying does not help. Okay, thank you very much. Thank you, Honorable Minister, and the press, colleagues and the press. Yeah, I think Ms. Aki just wanted me to comment about the returnees from South Africa. I think that has essentially been said. But just to underscore is that, considering everything we know from South Africa, just because South Africa did its job, okay? So they did their work and were able to identify the variants. But we know what is happening everywhere in other places. So I think that's why some time back, the ministry or government put in place measures, that was way back in October, to be able to detect incoming cases at the airport. If these have variants, there's already a system for detecting these. So like the minister said already, the measures that were in place actually were well positioned to detect any variants coming in. So like she said, we are very well positioned to identify and detect cases from South Africa, and from the number of cases that are turning up positive, track them effectively. Unless the situation changes, if the situation changes and more cases are being detected, then additional measures may be taken. But I think, like she emphasized, the measures in place seem to be adequate to detect and take effective action. I think that is responding to the question from New Vision. Thank you.
I think one of the questions that have been directed to me was, in case people give wrong information, what will happen? First of all, let me emphasize the fact that if you love your country, you will do all it takes to ensure that the population is protected and you yourself is protected as well. Many of us will recall what happened during the second wave and the challenges that we went through. And that is why I clearly indicated that we are relying on you, the public, to give us correct information. These people travel and live amongst us, and we know them. Now, from the time that we started testing at the airport, and from the time we allowed people to go home, we have been following up on average 6 people who test positive. And it is true that about 2 out of every 6 give wrong information. And we have been tracking them, because not only do we take your telephone number and address, we also have your passport number. So we have your passport number, we have your ID number. If you give us wrong information, the Ministry of Health is already working with NITA Uganda and with various other organs to track people. We will at the end of the day still track you, but it will be very unfortunate for you if you take infection that is not widely known to your family and to your loved ones. You have to care for your family and loved ones. The fact that we are caring about you and allowing you to go home to your comfort, it is extremely important that you also care about your family, your loved ones, and your country, and give us correct information to avoid going to the extremes to identify where you are and the embarrassments that will come with it thereafter. So we are relying on you to provide correct information. Dr. Misach has already answered most of the countries regarding the boosters. But before we even start asking for booster doses, we have 22 million eligible people. We have vaccinated 5.7. Can we first ramp up vaccination and cover these 22 million eligible people? And then we can start talking about booster doses. Because we also know that the more the virus circulates amongst us who are not vaccinated, the more the potential of a variant even emerging in our own country. We need to avoid that. So me and you need to work towards getting the 22 million people vaccinated as quickly as possible. Why the low uptake of the second dose? There is no low uptake. Many of you know that there is a time period between doses depending on the vaccines. The earlier group that took the doses are the people that are getting their second dose. And the second dose access continues, especially now that we are running accelerated campaigns. People are coming up to get their second doses. For AstraZeneca, you know it is over 12 weeks. So you don't expect that gap to be covered very quickly. We have the statistics, we are monitoring. But also we have a lot of backlog of data at the districts, meaning that actually the numbers vaccinated could be much more than we already know. The vaccines protect you from severe disease, hospitalization, and death. We have not said the vaccines will stop you from getting infected, but they protect you. and we want you protected. The goal from the very beginning has been to minimize the number of people who succumb to the infection. And therefore, we want to encourage Ugandans to get vaccinated, but also you are aware that the more we vaccinate and move towards herd immunity, the better, because then we will be interrupting transmission from one person to another. I thank you.
Dr. Henry was chosen to give a summary in Luganda of this presentation, but by a show of
nafe abatuwuliriza minisita ne bannamawulire. Minisita leero azze okutuwa update ku bulwadde bwa COVID. Atugambye nti ennamba y'abantu abaakalwala obulwadde buno eri 12,784 ate 3,252 be baakafa. Kati abali mu ddwaliro, abali mu malwaliro bali 115 mu malwaliro aga gavumenti n'ag'obwannannyini. Naye emu ku nsonga ezisinze okutuleeta okubawa update yeya kugamba akawuka kano waliwo engeri gye keefuddemu nga okuva e South Africa waliwo engeri y'akawuka kano gye kakyuseemu. Ate mu kukyuka kuno waliwo okutya, sigamba nti nno kyekiriwo, naye waliwo okutya nti akawuka kano akeefuddemu, aka COVID akeefuddemu, kayinza okuba tekawulira bulungi kugemebwa, ate tuyinza okuba nga tetusobola bulungi kakola ki, lab ziyinza okuba tezisobola bulungi detectinga oba kalaba. Then n'ekirala nti mukana akeefudde kisoboka okuba nti ate kayinza okuba nga kakamba okusinga engeri gye tubadde tukalabamu. Naye kwegamba okuteebereza naye bakyanoonyereza okulaba oba ekyo kyekituufu, ekyo okuteebereza buteebereza sofa. Mu nsi akawuka gye kamanyiddwa okuba nti kasaasaanye, kano akawuka akeefuddemu. Mulimu South Africa, Lesotho, Malawi, Mozambique, Namibia, Zimbabwe, Angola ne Zambia. Era abantu abava mu nsi ezo balabiddwa nti waliyo abantu abalina akawuka kano akeefudde. Abagundi World Health Organization oba ekitongole ekikola ku bulamu mu nsi yonna kye kayita Omicron. Kati Omicron ono Uganda kwegamba erina ebintu byetadde mu nkola okulaba nti akawuka kano akeefudde ke bayita Omicron tekasaasaana nnyo. Ekimu ku ebyo y'engeri y'okukola ki, y'okukwatamu abantu abajja mu Uganda okuva mu nsi ez'ebweru. Minisita atugambye nti okuva mu October Uganda yali etaddewo okukebeza buli omu ayingira wano Entebbe nga yakayingira, ne mu bitundu ebirala mwe bayingirira, ne ku booda ez'oku ttaka. Entebbe ekibadde ku kisaawe Entebbe ne ku booda ez'omu ttaka buli omu wakukola ki, wakukeberebwa okulaba oba alina akawuka. Bwagibwako sample eyo ajja kukkirizibwa, abantu bajja kukkirizibwa okudda eka nga balinda results bwe zinaavaayo bazibasindikire ku simu. Ababa positive, ababa nga balina akawuka bajja kukola ki, bajja kulondolebwa eka, bajja kuyitibwa n'okulondolebwa eka. Ababa tebalina nga si balwadde nnyo oba tebalina symptoms zonna bajja kulabirirwa eka. Ababa nga balwadde beetaagisa eddwaliro bajja kutwalibwa mu ddwaliro muzimu ku covid treatment centers eziriwo mu ggwanga. Kati yeyo yengeri baki abantu abatambula okuva mu nsi ez'ebweru, eyo yengeri gye banakwatibwamu. Si kyanjawulo nnyo okuva ku kibaddewo already, kubanga gavumenti yali etadde already mu nkola ekimala okulaba nti akawuka kano kabeera contained. Ebintu ebirala kwe kweyongera abantu kwegamba okufuna vaccine, okugemebwa. Minisita atadde nnyo essira ku kyokugemebwa, n'atugamba nti abantu bwe banaagemebwa tebajja kukola ki, tebajja kwetaagisa nnyo, tebajja kulwala nnyo. Okugema kujja kukola ki, kuziyiza abantu okulwala ennyo, okwetaagisa okuweebwa ebitanda mu malwaliro n'okufa. So ekyokugemebwa akitaddeko nnyo essira, era agambye nti okugemwa kujja kusembezebwa abantu, kujja kutwalibwa mu bantu, mu byalo, mu paaka, mu makanisa, mu bitundu ebyenjawulo, okulaba nti abantu bagemebwa obulwadde buno obwa covid. Atadde nnyo n'essira ku bintu ebya bulijjo bye tumanyi nti nno biziyiza okusaasaana kw'akawuka kano. Okunaaba mu ngalo, oba okukozesa sanitizer, okumakinga sure nti tetusaasaanya kawuka, okwewala omujjuzo, okubeera mu bantu abangi ennyo oba omujjuzo, n'okwambala obukookolo buno bu mask ng'ate tubwambala bulungi. Ebyo bye bimu ku bintu ebikulu ennyo bye tulina okugenda nabyo mu maaso, okulaba nti akawuka kano covid owa bulijjo nakano akeefuddemu ka Omicron tebisaasaana nnyo. Ndowooza ebyo bye bikulu ennyo. Waliwo n'ennamba wano gy'awadde abantu gye bayinza okubako bwe baba nga balina omuntu gwe basuubira nti ayinza okuba omulwadde. Bayinza okuba ku nnamba, ndowooza abamawulire bajja gituwa. So byebyo ebikulu ennyo, naye minisita era atadde nnyo essira ku kyokukola ki, abantu okumakinga sure nti bagemebwa. Vaccine weeziri, gavumenti so far yakafuna doses ezisukka mu miliyoni 17, ate era esuubira okufunayo endala December wanaggwerako miliyoni ezisukka mu 15. So buli omu asusse emyaka 18 nga tannagemebwa, minisita akusabye genda ogemebwe. Ndowooza byebyo mu bufunze.
The rest you can follow up with the PRO if you have additional information you want.